Namaskar. Today we'll talk about colon cancer, colorectal cancers, the cancers which arise from large intestine and could be lethal if not treated in time. So let's talk about colorectal cancers. With me, we have a very important guest to answer all our questions, Dr. Sharlene Gill. She's a consultant medical oncologist with expertise in gastrointestinal cancers in Department of Medicine, University of British Columbia, Vancouver, Canada. So yes, we'll be having a thorough, detailed discussion on all aspects of colorectal cancers. So yes, welcome, Dr. Sharlene.
Thank you, Dr. Tiwari, for the invitation, and namaskar to the audience. I'm very happy to be here and to talk about colorectal cancer, which honestly, I think we do not talk about enough, thinking about the reality of how common it is. So I'm very grateful for the opportunity.
So yes, ma'am, very rightly said, whenever we talk about cancers, most of the time the stage is always taken by breast cancers or lung cancer, especially in India, where colon cancer is still not a top 1 or 2 cancers. So I think we feel that maybe now the incidence is increasing, and that is where the first question comes, that what are the risk factors for colorectal cancers? And do you feel is there a difference among various countries or the continents?
Yeah, it's a good question. So the one thing we are seeing is that colorectal cancer is a cancer historically of the elderly. So as we get older, our risk for colorectal cancer increases. It's also a cancer that people feel less comfortable talking about because of the symptoms that are associated with colorectal cancer. So I think for a long time, people don't like to talk about their bathroom habit or their change in their stool, and that leads to some delay in seeking attention for these problems. In the Western world, colorectal cancer, is often in the sort of top 3 most common cancers. So after lung and then prostate in men and breast in women, it's usually colorectal cancer. I think if you look at global statistics, it's still in the top 5. There are different patterns that, depending on geography, sometimes there's more lung cancer, more head and neck cancer, more cervical cancer. So the proportions change, but it's definitely a leading cancer cause. Yeah. So risk factors for colorectal cancer, I think there are risk factors we can control and those we cannot control. So what we cannot control are the genes we inherit from our parents, right? So there are certain family history related factors, and so I think it's important for all of us to know our family history. Sometimes I talk to many patients and they say my father died of this or my mother died of this, but I don't know, right? And so for gaining that knowledge is important. It helps in the assessment. The other risk factors are things we can control. So things like diet and lifestyle. So for colorectal cancer, we know that there seems to be some association with certain types of diets that are high in red meat, diets that are low in fiber. Those may increase our risk for colorectal cancer. We know that exercise seems to be protective. So living an active lifestyle, and that usually includes like exercise at least 4 times a week for at least 40 minutes. There seems to be a lesser risk of many cancers, and colorectal cancer is one of them. Common sense things, don't smoke. That's not good for any cancers, and there is a relationship with colorectal cancer as well. And I think like early detection. So not being understanding what the screening guidelines are where in your country, and adhering to them, sticking to them.
That makes a lot of sense. So just to elaborate, whenever you search about the risk factors of colon cancer and you put it on internet, like you're doing a lot of internet searches, people. So it always comes the term Western kind of diet. So ma'am, is there a difference in the dietary patterns which you feel plays an important role in colon cancer?
Yeah. So I think a Western diet is unfortunately a diet that is, described as high processed foods, right? So, and so I think the globalization of like McDonald's and Wendy's has also led to, we believe, to a change in the epidemiology of colorectal cancer. We also know that certain diets are protective. So a lot of studies have looked at like turmeric, like haldi, and the derivative as being potentially anti-cancer. So for a long time, we thought, there's a diet that's not good for colorectal cancer and potentially a diet that might be protective. So diet is important, but the Western diet is the low fiber, high fat, high red meat processed, which is, not good for many reasons.
Okay. So in short, cut down on the processed food and yes, the more raw diet or unprocessed food you can have, and maybe a bit of turmeric. So some
Maybe
Indians will be feeling really good about that. Now we can have turmeric in food. Yes, that makes a lot of sense. So ma'am, since you were also mentioning something about the hereditary factors, and we also have a very important question from Dr. S. Balaji from Tirunelveli, a place in India. And he wanted to understand about what are the risk factors, where can you think that there could be hereditary causation playing a role? Where do you suspect it? And is there a way to confirm that?
Yeah, so I think we know that because most colorectal cancers are sporadic, meaning they don't come in the family history. We usually see that in our older patients, right? So the average age for colorectal cancer is about 70. We think, that's the highest risk group. But when I see patients in their 50s, in their 40s, I think a lot about, is there a family history component? So I think younger age of diagnosis or presentation makes us think about family history. And then obviously if there's, multiple family members, we think of certain syndromes like that are described with colorectal cancer. So we don't understand all the reasons why we get cancer, but I think if you have in multiple generations, if someone said, my grandfather had colorectal cancer and my father had colorectal cancer, even if they were older, I think those serial generations make us also more concerned about risk. We know now in 2021 that we can test for certain types of inherited predispositions, things like Lynch syndrome. And so it is a discussion if someone is facing a diagnosis of colorectal cancer to have with their oncologist about, should I have any testing? Do my brothers and sisters need to be screened? Do my children need to be screened? That's also an important question.
But it is possible to get a hereditary colon cancer even if you don't have a family history, is it?
So usually it's because the family history is not known.
Oh,
so sometimes people will say,
it's very common in India, yes.
Yeah, so sometimes, or people will say, my parents died at a younger age because of another issue, heart disease, or so they maybe didn't live old enough to get colorectal cancer, or people have a small family, like no brothers and sisters and things like that. So, so usually it's because family history is unknown. And so, but to your point, right, currently most guidelines say for any cancer diagnosed under the age of 50, colorectal cancer, even if there's no family history, we should be testing to look for the possibility of an inherited syndrome.
That makes a lot of sense, especially, ma'am, because one of the reasons is that now, because we now have access to quality investigation and the diagnostics in India, even in smaller cities. So more and more people are now getting diagnosed with colon cancer. And yes, at some point of time, it was like, we don't know how our grandmother, grandfather, they died. So we get a lot of missing family history there.
Yeah.
So, that really plays a big role. So that brings me to our next question, and a very common question. How do we detect it early? What are the symptoms which people should be aware of? Like constipation may be one of the symptoms, but everybody above the age of 50 years has constipation.
Correct.
Isn't it, ma'am?
Yeah. Yes. So that is part of the problem, is that the symptoms are often not too specific. So, I'll talk first about the symptoms, then I'll kind of mention about screening, because I think that's why it's so important. So when we say, oh, if your bowel habit has changed, so altered bowel habit, but like you said, Priya, that can be constipation, and or people say, oh, maybe I have sometimes some tummy pain and then it goes away. So non-specific symptoms. But if they are persistent, and particularly if they get worse over time, I think those we should not ignore. Alarm symptoms, so things where I would not wait and go to the doctor right away, is if you have blood in your stool. So if you notice, and this is a funny thing, but a lot of patients will say, I go to the toilet, I just flush the toilet, I don't look. But I think you should look at your stool. I look at the fullness of the stool. Is there any blood in the stool? I think this is something people are embarrassed about. But before you flush, look and make sure that you're not missing, there isn't any bleeding. That's something that you should go to the doctor right away. Other things, if you're losing weight, but you weren't trying to lose weight, so unintentional weight loss, that makes us also worry a bit. But many times, I have patients who didn't have those kinds of classic symptoms, and so that's why screening is important. So by definition, screening is when we are healthy, we feel fine, but we are doing the test to look for any early evidence of cancer. And for colorectal cancer, you think of the colon, or it's like a tube of muscle, and polyps, which can arise from the inner lining of the colon, can go on to become cancer. So it's they're a risk. And if you can find the polyps and remove them early, you can potentially prevent a future cancer. And many studies have shown that this strategy of screening does reduce the deaths related to colorectal cancer. Different countries have different types of screening. I practice in Canada. In Canada, the recommendation, if you have average risk, meaning no family history, and everyone age 50 should get a stool test for blood. We call that, fecal occult blood testing. It's a more, and if that test is positive, then you need a colonoscopy. If you are higher risk, if someone in your family, like a close relative, parent, brother, sister, had colorectal cancer, then we recommend screening by colonoscopy, because we think the risk may be greater you might find something. And so, I think in different countries, there's different guidelines about whether it should be stool test or whether it should be colonoscopy. But, the important thing is being aware, because honestly, I see so many patients, even in Canada, where we have free public health care, who are age 60, 65. Have you ever done screening? No, I never. They didn't want to do it. So I think we have to be much better in educating our patients. So what you're doing today, to understand that screening is available and it should be done.
Yes, ma'am. So it's a very important, actually, the whole point of discussion in India, we still don't have population-based screening, especially for colorectal cancers. So just to summarize our discussion, so the thing is, colon cancer is one such cancer which can be picked up when you don't have any symptoms by simple process of screening. By screening, we try to find out lesions called as polyps, which are small lesions present in large intestine, and they could be present for like years altogether, and then the cancers might arise from them. Right. And these are the lesions we are trying to pick up, and maybe sometimes the cancers have already formed in them, and we can actually pick up these cancers also, and that will help us to get rid of either the polyps or the cancers in a very early stage. Isn't it, ma'am? Yes.
Yeah, very well said. Yeah, absolutely. It's about preventing cancers, and it's about potentially finding a cancer early so it can be cured.
So that will be, if, in India, people become so aware that they are able to undergo these tests in a timely manner, we'll be able to prevent so many deaths. Maybe still the colon cancer is not the top cancer, but because India is such a huge country, we get a lot of colon cancer patients. Yeah. And the unfortunate part is that because we are not able to detect these cancers in time, we lose a lot of patients. Yes.
Yeah. Yeah.
So, yes, ma'am. So, yes, a very important question. And this was asked to me by a lot of my patients. Is there a blood test which can help you in screening for colon cancer?
Unfortunately, no, there isn't. We don't have a blood test for screening for colorectal cancer. sometimes for some cancers, like people here, for prostate cancer, there's a blood test where you can have some cancer markers that you can find in the blood that are very sensitive, so they can work well for screening. For colorectal cancer, there are some cancer markers, but they don't work for screening, so they're not something we would rely on in 2021. Now, it is possible that by the time our kids' generation is of the age for screening, that the technology will be that you can find, like the DNA of tumors floating in your bloodstream and be able to do early screening. I think that's where the field is going, but we're not there yet.
So hang on, people.
Yeah.
So I should say, hang on, people. Science is working on it.
Science is working on it. Yeah.
So, ma'am, if we're talking about, now we have covered the symptoms, screening, early detection. So that brings us to the question of treatment. Suppose if somebody, either by symptoms or by screening, we end up finding colon cancer. What to do next? Yeah. And the biggest question, one of the common question, and this was also asked by one of the participants, Mr. Ravi Kumar from Bangalore. Is it curable? People in India think cancers are not curable. Cancer means death sentence. So please highlight something about the treatment and then about the cure rates, outcomes, survival rates.
So there's a lot in what you just talked about, which is true around the world, right? So even in Canada, North America, cancer is a very fearful diagnosis, right? So, and it's all about early detection. So treatment of cancer is dictated by stage, like, what was the extent of the cancer at the time we diagnosed it. And so, I have been doing this for 20 years and I only treat these types of cancers. And one thing that hasn't changed is the need for surgery. So if we have an early stage cancer, meaning a cancer that is in the colon only or in that area and no spread anywhere else, then we have to we do surgery up front. Once the cancer is removed, we then look at what is the extent of the cancer. Did it affect any lymph nodes in that area? And make a decision about what is the chance that the cancer could come back. And if that chance is high, we generally recommend chemotherapy. So many studies have shown that what we call adjuvant chemotherapy as a preventative chemo approach in high risk, colon cancers that have been removed by operation, but we're worried maybe there's some microscopic cancer cells left behind, can help reduce the risk of recurrence. So surgery, and then in many cases, surgery plus chemo. The more difficult situation, I think, is the situation where we have cancer diagnosed, and by the time it's diagnosed, it has already spread. So we say it's metastasized, metastatic cancer. For colon cancers, the most common site of metastasis is the liver. And in some cases, there is a possibility that maybe you could do surgery on the colon and remove the cancer in the liver. And some of those patients might be cured in the long term. But for many patients, surgery will not be the answer for what we say metastatic stage 4 colorectal cancer. And then we rely on medicine, on chemotherapy types of treatments. The good news is that, a lot has changed in the last 20 years in terms of chemotherapy types of treatments. So we have chemotherapy, which is still very important in colorectal cancer. We have targeted therapies, so things that may help the chemotherapy to work better by really focusing on what makes the cancer grow, right? And trying to block that. We have, for some colon cancers that might respond to immune therapy based on some testing of the tumor, we also now have immunotherapy as a potential option. We are in a situation now where we have many patients with metastatic stage 4 cancer who may not be curable, but are living with disease much longer. So we are improving our survival. I cannot say that it's decades, but many patients can live for a few years with metastatic disease on chemotherapy. But that is unfortunately an incurable situation. And so it comes back to what we were talking about earlier, is how do we make sure as much as possible that we pick up cancers when they're curable, when they're early and when they haven't spread. And so that's about the symptoms and the screening.
Wow, ma'am, that actually, yes, that actually has summed it up very beautifully. So what I gathered was that, yes, find it early so that you are able to cure it if the cancer is a localized disease, colorectal cancers. Depending upon the extent of disease, we do have treatment options of surgery. In certain cases, it might be followed by chemotherapy. And yes, ma'am, that was a very beautiful answer, because this is a constant question. Why are we giving chemotherapy if we have removed the cancer by surgery? So yes, there is a chance of cancer coming back, and that is what we further want to reduce it. And that is why we are using chemotherapy. The most dreaded part is the cancer is spreading to all organs or more than one or more organs. That is the metastatic cancer, because cancers are capable, especially via the bloodstream, they can go into various organs. But yes, there are treatment modalities beyond chemotherapy. We have newer advancements, just like you rightly said, immunotherapy, and yes, maybe based on certain mutations, targeted therapy, which can help you to live long, maintain a quality of life, at least for a few years. Isn't it, ma'am?
Yeah. And I think, we continue to work to try to improve, those outcomes, like help people live longer with cancer. But I think that, at the end of the day, I find that patients who are asking questions, who are informed, who are not afraid of their cancer, but want to learn more about their cancer, are the patients who are in the best position to take advantage of these treatments. So I encourage my patients to be as educated as possible about their diagnosis. I'm sure in your practice, it's the same thing. Many patients will be like, well, you decide, Dr. Gill, whatever you think.
Yeah,
but
they'll put ball in your court.
Yes, yeah. But I think that this is, I look at my patient as, we are your team.
Yes.
And so as much as you know about your cancer and understand it, I think we can work better as a team. And, hopefully help our patients, do better, even though, we have cancer.
Yes, ma'am. I think the whole idea is to bring clarity to the situation, and they feel that you have more clarity. So maybe you take a decision, but it's end of the day that you have to weigh the options, the best of options, and then let the patient decide. So we have to give them that clarity that we have.
Yeah, it has to be. Yeah, we have to give them the information they need to make that kind of informed decision. That's our job. And of course, we are here to provide the expertise. But I really like these kinds of engagements where we're trying to spread the word and raise awareness for colorectal cancer, because even though it's common, I can tell you it's not talked about as commonly as, especially in the Western world, as we talk about breast cancer and prostate cancer. So I'm always happy to talk about colorectal cancer.
Sometimes, the patients are trying to get so much clarity. They'll ask you, if your mother will have this kind of cancer, what will you do? So, I'm sure that even you would have those kind of questions.
Yeah, all the time. And I think it's I always say these are personal decisions about treatment choice.
Yes.
And, I think, I those are hard questions when they ask, what would you do? And what would your family member do? But I think it's understandable.
So that brings us to a very important question, ma'am. And you actually initially highlighted about ways to prevent cancer. You took names of various risk factors. So if somebody asks you, what are the ways to prevent cancers? And there's a lot of literature written about role of vitamin D, role of various NSAIDs, role of aspirin. So please highlight on that aspect.
So it's a tough question, because I think that we want to believe that there is something that we can do to prevent it. I think there are things we can do to reduce our risk. We've talked about that a bit in terms of diet and lifestyle. And the issue with supplements is hard, because there have been many studies kind of looking at, was vitamin D, folic acid, aspirin, and none of the studies have given us a clear answer to say it's a good idea. So in my practice, I tell all my patients to take vitamin D. You might ask why, and it's because, I live in a country where the sunshine is very low. We don't get a lot of sun. So I think most of our population is vitamin D deficient anyway. It's good for bone health. And there is some data to suggest that higher intake of vitamin D may be associated with lower risk of cancer. And so in that situation, I feel like potentially high benefit, low risk, right? And so I tell all my patients, I personally, I take 1,000 units of vitamin D a day. It's not, I don't do it with the sense of thinking it's going to prevent cancer. I think I do it as something that might reduce the risk. Aspirin is a harder one. I think there's a lot of evidence to show aspirin as a prevention for colorectal cancer, mostly in people who have a pre-existing condition of getting lots of polyps. That's where most of the evidence seems to be of benefit. For every average person to start taking aspirin, we know that in some people that could give them trouble, stomach trouble, bleeding trouble. And so it's a harder recommendation to make for everyone. But I would tell people that, ask your primary doctor, if you think you would want to do aspirin, try aspirin. There may be other benefits to it. If you have cardiac heart risk factors and taking aspirin a day is a good idea anyway, maybe there will be an added benefit here. But that requires a discussion with your doctor, I think.
And maybe cut down on your alcohol intake.
Yes. Yeah. So all of those, that's again, we talked about maintaining an active lifestyle, but there's also something about maintaining a healthy weight.
Yes.
And while alcohol doesn't directly cause cancer for colorectal cancer, maybe for other cancers, but it does contribute to an unhealthy weight. In many cases, it's just empty calories. And so, so low alcohol, have a glass of wine. I will do that sometimes.
Takes us to medical oncology is very unpopular. We always talk about cutting down on alcohol.
Yeah. Low alcohol, no smoking, get out and go for a walk every day. This will help you live longer.
Yes.
Eat healthy. Yeah. It's not a joke.
So ma'am, but in India, we have a lot of sun. Still, we see vitamin D deficiency very commonly because sun is so strong, people are actually not stepping in the sun.
Correct. Yeah, fair enough.
You don't have any sun, still vitamin D deficiency. We have a lot of sun, still vitamin D.
Yeah. Yeah.
So I think, ma'am, we have covered all the aspects of vitamin D. If you want to have any closing message, and then I think we'll be just wrapping up this discussion. It was really very fruitful and enlightening in various ways.
Well, thank you so much. I mean, all I would say is that, the things we can control, we should try to control. And so those are the risk factors that we can modify. We just talked about it: healthy eating, staying active, maintaining a healthy weight, knowing your family history, being aware of the symptoms and seeking attention early. And also know that there have been a lot of advances in the treatment of cancer in recent years. And I feel the pace with which things are changing. I'm very hopeful that, we will be at a time where we could potentially cure all cancers. But right now, I think, we are making improvements, but we have to really focus on prevention and early detection to make, real difference.
Okay. Yes, ma'am. That is very well said. And I think that we are already better than what we were 20 years back. And yes, in next 20 years, the scenario will be much, much, much better. Yes. So, ma'am, okay, so we have a chat request. Do you have any professional or personal contact number that you would like to share for any question, or maybe email ID? Some of the viewers are actually requesting for that, for any question or queries.
Oh, I hesitate to do that a little bit because I get a lot of emails about people asking me about their cases. And unfortunately, I'm not in a position, you know this, you must get this a lot, to be able to do that. But maybe if there's a specific question, someone could contact you. And if you feel it's something appropriate for me, you could pass it along. Is that okay?
Yeah, sure.
Okay.
Yes, I'll do that.
That'd be great. Okay.
Yes, because I think some people really loved you.
That's very kind.
Yes. So that will be all, ma'am. Thank you. Thanks a lot, ma'am.
Thank you so much. Thank you. Have a good evening.